Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo, and we're kind of, it's at first when you pitch this topic, it doesn't sound like interesting. It doesn't sound like much. It's not a big sexy thing. It's not, a gaping wound or anything. It's HIPAA. And then you get into thinking about it, and it's wildly interesting and affects all of us, huh?
Right. So I took a kind of a step back and looked at the bigger picture of medical privacy. HIPAA is only a small part of that. But medical privacy is the maintenance of security and privacy of patient records, all right? So it covers conversation, medical settings, physical exams, modesty in the exam room. I mean, it's a huge topic.
Okay, let's start really, really basic. I've forgotten. What's HIPAA stand for?
Health Information Privacy and Protection Act.
Okay, so there's two P's. That's what.
Yeah.
Okay. All right. So,
and it's super hard to do. So it's especially hard to do with electronic medical records. And so I'm looking at mostly at that part of privacy. And HIPAA showed up in 1996. So when paper charts were a thing, it was easier to lock them up at night and keep people out of them and keep them safe. But electronically, it's more difficult to keep those records safe. But also, more people have kind of quasi-permission to have access to stuff.
Okay.
So, and the way this came up for me was I'm applying for long-term care insurance right now because, I'm of a certain age and it makes sense. And I was at a telephone interview and I was instructed, I have a paper template of questions they were going to ask. So I was instructed to get my med list together. And so I said, do you guys want to know my meds? She goes, we already know them. And I'm like, what?
So obviously, right there, then insurance industry has access to your private records,
right? And without thoughtful interpretation, because I'm on like a blood pressure medicine, not for blood pressure. I'm using it for an off-label use. So they don't have that nuance, and so they make decisions based on ignorance. So anyway. Most people think that medical privacy is to keep people from gossiping, but like I just said, it's super hard. It's bigger than that, way bigger than that. Patient care information is routinely shared by third-party people, corporations usually. And most people have no idea this is going on, nor have they given permission for that. Right. And so the example is probably what I experienced and so I'm like looking up, like, how do they know what I'm on? So there's something called the Medical Information Bureau, which is a pool of individual medical information used by insurance companies to decide who they're going to pay for, who they're going to offer policies to and under what conditions, kind of on an individual level.
Okay. So who runs the Medical Information Bureau?
I didn't get a really clear answer on that. It seems like partially shady, but I think it's a coordination of governmental and insurance companies.
But that leaves so many things unanswered.
That's so shady. And when let's say one goes to Sutter to get a chest x-ray, and then you have to sign a piece of paper saying it's okay for them to release your information to the insurance company so that you can be billed. But it doesn't
it's more than that.
Yeah, it doesn't really say what else they do with it. And so I think we give like this okay that we think is for one specific thing that we want to have happen. We want that chest x-ray billed to our insurance company, and they take it and run. Right, and
just open you up to all sorts of things. This was, this is just blowing me away.
I know, and it gets worse.
Great. Well, first off, let's recap. HIPAA is supposed to protect your privacy.
Right.
But it seems like it is completely constructed, other than that front-facing facade that faces you, it's just all back doors.
Yeah.
Right?
Completely. So,
wow.
Yeah, and HIPAA showed up about the same time electronic health records showed up because they realized that there was a problem, okay?
But did this address any problem or merely just codify
both?
What was, okay.
It did both.
Wow.
So it's kind of sold to people as solving the problem of your ex-sister-in-law
Right.
happened to work in the office where you go, and they know that you had routine gonorrhea and chlamydia
You're going to
screening.
get blackmailed.
And now she's mouthing it around to the whole town.
Right.
Yeah.
But that's not it.
That's not it at all.
Oh, my God.
Not at all. And unfortunately, there have been providers and nurses that have actually been canned for saying the most innocent things.
Okay.
So, but we won't. That's not what this is about. This is about the dark side.
Well, first off, let me just say this. I said this before we started recording, is that as a member of the media, time and again, I've asked for details about something in the public record, and I have been shut down saying, oh, HIPAA, I can't share that with you, HIPAA.
Right.
But if I worked for an insurance company...
Right. It gets sent to you.
Wow.
Wow is right. And you might say...
Sorry, it's me.
So not only are third parties collecting private medical information for targeting marketing and to know who to insure and under what circumstances, but they also resell it.
Yeah, wow.
So it's kind of an echo chamber. It's going on and on and on.
Wow.
So, but think about what's in medical records.
I don't even know what's in medical records. What's
Well,
in medical
your
records?
name is there attached to your record, your birthday, your contact information, oftentimes social security number.
Jesus.
And it goes from there.
Yeah.
And so one example of a friend of mine who was on a drug that's commonly used for Alzheimer's, and somebody put in his chart when he was hospitalized at Sutter for an completely unrelated thing that he had it because he had Alzheimer's. And so that spread, and he tried to get him to take it out of the chart, but they wouldn't do it. That's notoriously difficult to do. So bad information goes in the chart all the time. And now he's wondering what his medical or his legal status is in the world. If he tries to sell his house, is somebody going to shut that down because he quote unquote has Alzheimer's?
Oh my God. Can somebody come and get power of attorney out from under him because he's got quote unquote Alzheimer's on his medical record?
Right.
Whoa.
So it could be a big deal. Drugs are used for off-label things all the time, and there's a nuance that, Joe insurance guy isn't going to understand.
Oh my God.
But it gets worse. Okay.
Quit saying that. Okay. All right. Go on.
Dun, dun, dun. So this is something called Project Nightingale, which I actually have to admit I do not understand at all.
Okay.
And so it showed up in 2019, and it was a data sharing agreement between Google and Ascension. So Ascension is the largest kind of conglomerate of Catholic healthcare systems. And supposedly this was a HIPAA-approved project. So that makes me think that HIPAA has two sides to it. One little teeny side that makes Joe Average patient feel more content and protecting and then this whole back door.
Yeah, it's all back to
blown open.
Exactly. So this was an agreement between this Catholic healthcare system and
it's a huge Catholic healthcare system.
Okay, whatever. Yeah. A huge Catholic
lot of people.
Which the name is Ascension, which that's just hilarious to me if that's your healthcare.
Yeah,
but anyway, Google and Ascension and they're going to share medical information, but who and for why?
It seems a little unclear. So there was no medical or patient notification of the sharing. So that's weird.
So where did Google get this medical information? Or was it coming from Ascension?
Coming from Ascension.
Ascension to Google.
Patients at Ascension, their electronic medical records were being sent to Google. Without consent.
And no idea why? Nothing ever was said about why this was happening?
Nothing was ever said. This is super shady. So
did Google pay Ascension?
I think so.
Wow. Did they just sell the information of their patients so that Google could do whatever?
That's what it looks like. So the information was shared in debt. So beyond the usual identifiers we just talked about, it also included diagnosis, allergies, exam findings, and here's what's scary to me, narcotic prescriptions.
Wow.
So now all that's known to Google.
And then to whomever Google wanted to share that information with,
because
for whatever reason.
There's always a next step because this is valuable data.
And so this is. So who enforces HIPAA? Like who is there?
Federal government.
Is the federal government? Should the federal government in some position above all of this looked at Google and Ascension and said no?
So they did, and nothing seemed to have come of it.
They said no? Or they did. They looked and let it happen.
Yes, the federal government looked at it.
And that was fine.
It was deemed HIPAA approved. So that makes me think there's like this dark side of HIPAA.
But if I want to know whether or not we have rape kits in Del Norte County and whether or not they're being applied to specific cases, I don't get an answer because of HIPAA.
Yeah, so what I do when I get that kind of blowback, this is just an aside, is that I say, I don't have a patient-specific question. I have a procedural question.
Oh, does that get past that?
Yes.
Because then you're not,
yes.
okay.
It's a procedural question.
All right.
And then their HIPAA defenses are useless.
Okay, ooh, that's a good trick to know. Okay,
yeah.
All right.
Okay, so as far as I could tell, there was no corrective action, no punitive action, and I'm wondering how many, it's a weird name to me too, Nightingale Project.
Yeah.
Is it like really? They're
No,
gonna sully
they're just
her
trying to
name?
make it sound right.
Yeah.
Sound like something you don't want to be afraid of.
And so my next question is, so how many other, projects are like this that are going on?
Wow.
Yeah.
Oh my God. Okay, I want to look up. I'm going to look up Project Nightingale. That's just.
Yeah, and you might be able to get in more, because you have a reporter's mindset and resources. So tell us more. But anyway, this is beyond HIPAA, and we should be thinking really closely about how consent impacts privacy. So if you're saying yes to something, are you really saying yes to all these unspoken agreements too that you don't have any idea about? When you sign the little form. Because you can't get the chest x-ray paid for unless you sign the form.
Right.
It seems straightforward, procedural, eyes glaze over, just give it to me, I'll sign it. You're not a lawyer, you're not going to scrutinize all 6 pages of it.
Wow. But see, what gets me is it kind of seems like they're kind of figuring you won't. So it's like a trick. Instead of it being a question about your health care.
Right.
Oh my God.
And is it okay to use personal information for public purposes? Maybe sometimes it's okay. Maybe the number of people that have positive COVID tests in Del Norte County in a certain month, that's epidemiology data. So that could be used for good. Okay. But this doesn't seem to be what they're doing. And are there ways of using health information to discriminate against people? And so that we kind of knew that about HIPAA. If you didn't get if you got your immunization, are you being discriminated against? If you didn't get it, are you being discriminated against? What's the impact on the individual once the dark side gets a hold of all your info? That's like the example of my friend. What are they going to do when it's time for him to sell his house or make a stock purchase or something?
Right.
Yeah. And then this kills me. Who's responsible for unwanted disclosures? Because all this stuff can be hacked, right? Google's never been hacked, probably has. And so my personal information, as an aside, has been lost by a lot of public institutions. And I'm talking mostly about, name, address, phone number, date of birth, social security number. And I get the duly noted letter, like I got one from 23andMe recently.
Oh, really?
And it offers no solution except for it kind of sucks to be you.
Oh, well, sorry, just heads up.
Bummer.
Here's a heads up.
We'll never do it again. So, Stanford University, when they lost all my important, pertinent information, they did give me, internet security protection for free for a year. That's the only responsibility that was ever taken. I'm talking about 10 data breaches. It's not that uncommon.
I got a class action suit notification this week that down the road I may be eligible for my chunk of this class action suit, all of $30 they estimate. And this is just ridiculous to me. It was personal information that came from our account, my account, with Crunchyroll, which is an anime streaming service for Japanese cartoons that we watch. We watch Haikyuu, our favorite. It's volleyball anime, and it's Shakespeare in cartoon form. It's wonderful.
Oh, cool.
But there's this whole, it seems like my Crunchyroll account had more people looking over and making sure everything was okay than my health records do. Other than the Bureau of Medical Information or whatever.
Which government was responsible for that? Was
Yeah,
that
I
the
don't know.
Japanese government? Did they do better?
I don't know.
Yeah.
Oh my God.
I know. It's kind of a nightmare.
I think my personal records, my healthcare records are actually available in a vending machine in Tokyo is how it works. Yeah.
No, it's some dude is selling them out of his mother's basement in Moscow.
It's a weird, strange world we live in.
Yeah, and they're probably well organized. You're probably in several files, like male, your age, American, or kidney stones, likes Toradol. Oh, wait a minute, did I just spill the beans?
Hey, that's a HIPAA violation. I've had kidney stones, and I really like the Toradol they gave me to stop the pain. Yes,
yeah, because
there, full disclosure.
Yeah. So my next question is, after who's responsible for this? Like if my data got spilled with Project Nightingale, who do I get pissed at?
Right.
I don't know. And do we have enough of the right safeguards? So we've been just merely assuming that what's important to us as consumers of healthcare is important to, let's say hospitals and clinics and labs as providers of healthcare, which is also as important to, let's say, epidemiologists in the CDC or let's say insurance companies.
Well, all the different facets of information there are out there. Is there a way to safeguard that information?
Apparently not.
Right.
HIPAA was an attempt, but, we're coming back around to the basic question, is healthcare right or privilege? As soon as money's involved, it becomes a commodity.
Your information, your medical information, you become fungible. Yeah, you become a commodity. Your reality becomes a commodity for everybody. Even your attention, looking at your phone for however many seconds on each screen. I mean, that becomes a fungible commodity then.
Right.
And
yeah, completely. And what are the repercussions? So you can just be vaguely pissed that, that all your stuff is out there.
I'm more than vaguely pissed, but
but I'm vaguely pissed. But I saw it in action when I was trying to get this health insurance. I had a 2-hour interview about my health care and with somebody who's not medically trained, who's a young woman with a lovely Southern accent, and I think that's set up so you don't get mad and yell at him.
Because you sound like Fanny Flagg, I'm not going to get mad.
Yeah, you don't want to hurt her feelings because she sounds like she's got Bambi eyes and stuff.
She baked you some popovers, so you can get them over.
The intricacies of medical care were lost on her, and she's collecting information to make a significant medical decision for me, a future medical decision.
Is she making the decision, or is she just running down the list of information?
But she's all about how I have high blood pressure because I'm on a blood pressure medicine for migraine prevention.
Was she going down a list of questions that she was checking?
And what she already knew about me was freaking scary.
Wow.
It's really scary. So, 2 hours of, and find this out and call back and find this out. And they were asking me questions like, I told him I had a cough for 10 years because I have cough variant asthma. And she goes, would you say that's an acute cough or a chronic cough? And I'm going, anything in medicine over 6 weeks is by definition, chronic.
Yeah.
And she's like, not getting it. I had to explain that to her.
And she knew what you did for a living?
Yeah. Yeah. And she was calling from North Carolina, and I went to school in North Carolina. So finally she's like, got it that, Anyway, the whole thing went on and on and on, I think longer than usual. So I'm wondering what they already knew about me going into it. And it seems disappointing. Really disappointing.
It seems like I'd even be happier if I just was notified by whoever, the Bureau of Medical Information or whoever. Here's how much your life is worth to us. Here's how much care you can expect. Because that seems to be what it boils down to every time. We have to go through all of these motions just to get to that little nugget of information.
Right.
Just tell me right now so I can plan for the future.
Right.
Don't promise me things that aren't going to be there.
Yeah, do you think you can be real so I can make plans?
Right.
Yeah. I totally get that. So I'm wondering how many other Nightingale projects there are out there. My guess is that this was just the one that got caught.
Well, it's also
nice.
It's the intended one. It's not the hacked one, right? Which is also things.
This was HIPAA approved by the information I saw online.
Now, do you recall, was there any sort of stipulation about how, personal information was separated out from all of this, or just a big data dump?
What it sounded to me like an enormous data dump.
Wow.
If you look on electronic medical records, they have a lot of information about you. When you you're dutifully filling out millions of questions on reams of paper, that all gets data entered by some overworked medical assistant, maybe front desk person. And do you think it's 100% accurate?
Wow.
These people are good at their jobs, but they're not necessarily medically trained, and they don't really understand what's behind the questions that are being answered. And I think it's really easy to, air quotes, innocently give information to the dark side.
Well, even and just as you were saying, like they didn't know how to ask you the questions to get to the actual knowledge that you had, the specific idiosyncratic knowledge of your condition.
So they got the nightmare person on the interview. I bet they're all going, oh, goodness. But because medicine can be persnickety and particular, and that's how I answer questions medically. So
good for you.
Yeah. But the whole thing was super interesting. I talked to 3 people, all young women, all with vaguely Southern accents. So I think they're trying to make these conversations as non-threatening as possible.
Wow.
Yeah. And they seem to be really good at kind of drawing information out. Kind of interesting. Well, we'll see. I haven't heard whether I passed or not. So
did they know what to expect before you called up? I mean, I'm wondering.
I think they did their homework on me. Is that what you're asking?
Well, no, I'm wondering if let's say you lived in an urban setting and you were African American, would you get a black person with a northeastern accent talking to you, or would you still get that same Southern accent?
I have no way to evaluate that. But it felt like they were intentionally. I could have gotten the IT guy who doesn't really want to talk to me, who's already seen my date of birth and decided I don't know computers because I'm old.
Yeah.
So it was just the vibe. I didn't ask him like, hey, is this how you guys set this up? Maybe it's a super low paying job and that's the only job
that's all they got. Yeah.
Certain people can have,
wow.
In their community. I don't really know. But it was creepy what they already knew about me. Really creepy. And weird that you're given a form that you're supposed to use as a guide during the conversation. So let's say you have your med list already collected and certain dates of like when I had a C-section, when I had my gallbladder out, all that kind of stuff. She already knew all that.
Yeah. Wow.
So I don't know. Did they lure you into like complacency or something? I don't know. It was weird. The whole thing was weird.
It's a trick question.
So,
how many kidneys would you say you have?
Yeah.
Trick question.
Some people have 3.
Some people have 1. Why don't we ever do a Health Matters about the people with 3 kidneys? That'd be awesome.
Because they're not that common.
Oh, it'd be like clickbait, wouldn't it? Okay.
I know.
That makes sense.
I've met some.
Wow.
Yeah. Super
do you
cool.
get any benefits from having a third?
No. Usually one of them is not working right.
Is it okay? Yeah.
So
that makes sense.
It's more of a hassle than it's worth.
Wow. So I would like to know. I would like to know more about the Medical Information Bureau. I'd like to know more about Project Nightingale, and more about just. Well, I know how this works, and it's so hard for me to not just get like I don't know, down about oh yeah, here we go again. Here's another system that's sold to us to be one thing, that's promised to be one thing, when in fact it was consciously from the outset meant to be the exact opposite, and we're not supposed to see it or notice it.
Right. It's like how you name a law matters because that's all people ever read of it.
Right.
And they just hope for the best.
Yeah, exactly.
Yeah.
Well, I still call it Obamacare.
It's not Obamacare. It's the Affordable Care Act.
You're going to tell me this isn't an Obama phone, too?
No. But it's, someday I'm going to open my computer and for a busy day in clinic, and it'll be at the end of clinic, and I'll be ready to sign off, and I'll hear Hal's voice. Lynn, you're not done yet.
Oh my God.
I know, it's super creepy.
That is, yeah. It is. Wow, HIPPA. Oh, thanks.
Yeah,
Thanks
not
for
what we
all.
thought it was.
Not what we were sold it was. But still, this goes back to the whole, like, again, it's the same thing as with the online, the electronic records, right? We were sold one thing. You know, Al Gore told us the online medical records was going to be this one thing and how it was going to work, and that's not how it was.
Well, I think that they had... I think the guys in the white uniforms, the guys on the side of good, had an idea, and then I think the guys with more dubious intent just manipulated it to their own extent. You know, for
really?
their own, yeah.
You think? See, but here's the deal. I mean, that's a really simplistic way to set this all out.
Right.
Did the guys in white, were they the guys who designed the system? Because the system was
I think they were
designed
the
to be-
guys who were sitting around at a bar talking about how cool it would be, and somebody sitting at the back table by the bathroom was listening.
That's really nice of you.
And they thought, how can we take this and run
That's
with it?
very nice of you. I think the guys in the white suits are also the guys in the black hats. I think our system is just made that way.
Maybe that's true, but I still believe that the providers, especially the ones in this community, are good.
Well,
Are on the side of good.
that's because of you.
And
You're on the side of good.
we argued against like aspects of this, like people quit.
Yeah.
You know, and it's 47% burnout right now with physicians in kind of in general in the United States. So they see what's happening. They're not super happy about it.
Wow, man, 47%.
Right.
That's something. That's something I'd like to explore, and I don't know if we have.
Burnout, yeah.
Oh,
It's
just
on my
burnout, but-
list. Coming attraction.
Okay.
Yeah.
Okay. Yeah. Yeah. How being in healthcare affects you.
Oh,
That
me
would be-
personally?
Well, yeah,
I'm not a
personally, or
big
just as a
example.
professional, as a professional
Yeah.
class.
I'm perpetually Susie Sunshine.
Oh, really?
But, oh, yeah. Oh, you doubt me?
Well, I don't know. Yeah, I mean, because there are times you don't seem particularly sunshiny.
Yeah, that's true. Okay. Good point. Oh, I try to be.
Well,
So-
good. That's important. But yeah, I don't know. You seem to me like somebody who, the sunshine's one thing, but push comes to shove, you're taking care of business, and the sunshine
Right.
can go
That
out the
is
window.
true.
Yeah.
Right. So, but I have exciting news for next week.
What's that?
Are we? I was talking to the woman who's the CEO of United Indian Health. She came up to do kind of site visits and connect with Del Norte, which is like super cool.
Yeah, yeah.
And she was visiting our pod where we do mostly pregnant women, young families, little babies, stuff like that. And our pod is decorated kind of according to that theme. And I was talking about their Saturday clinic and how a lot of people don't seem to know about it. But I think for the young moms and young families, it's going to be super important during cold and flu season. So I kind of was checking her out to see if she wanted me to put that out on the air. And she's super excited about it. And then I said, do you want to come and talk to us kind of informationally about what UHS is and how it fits in this community? She was all over it.
Right on.
So my hope is to get her in the next time or two.
Okay. Okay.
And super positive voice, really excited at representing her organization, a Native woman of some incredible talent. And so
Fantastic.
looking forward to talking to her.
Wow. That's remarkable. That would be a scoop.
Liz Land. Her name is Liz Land. So,
Liz Land?
Yeah.
Okay.
Yeah.
Okay. Do you notice she have a medical or an administrative background?
She has an administrative background.
Yeah, that was probably
Their
what you
medical
need.
officer is Chris Myers. He's a physician, surgeon, actually.
Oh, wow.
Yeah.
Wow.
So
UIHS is one of the, 2-3 stanchions of healthcare in Del Norte County and Donatal in general, I would assume.
yeah, there
It's
are
a-
moments when it's the most functional healthcare in Del Norte, most functional pharmacy.
It seemed like that through COVID. It seemed to have handled or dealt with the pandemic, I think. I don't know, just on surface with the cohesion with its community too, with UIHS.
Right, they have a central mission, and I'm sure she'll speak to that, and that's that really does guide everything they do. But they also know that they live in a community, and actually have family members. There's Native families who are mixed, non-Native and Native, and I'm sure she'll speak to that.
Great.
The ties.
All right, right. We look forward to that. That'll be fantastic. Anything else for this week?
No, but I like the burnout thing. Maybe we'll talk about that later.
Okay.
I think that the homeless clinic is going on behind the superette today. So anybody who needs that kind of assistant, you don't have to be homeless.
Yeah, anybody can walk up.
Yeah,
and-
there's a
and-
physician there today. It's not me.
Oh, wow.
But they also have other resources. Yeah, you can fill up on your Narcan if you need some.
If you're hearing this on the Sunday that we record it today, and it will be played in about an hour on the air, then yeah, you can get down. It's just right up the street here on Elk Valley Road in Crescent City, and right up behind the Superette there,
Right.
and every other Sunday back there.
Yeah, and remember, there's an acute care clinic at Del Norte Community Healthcare on Saturday from 10 to 2. It's walk-in, no appointment needed. I pretty much will see anybody, whether you're a patient there or not, whether you speak English or not.
Wonderful.
Okay.
Right. Well, thank you very much, Lynn.
Yeah, you're welcome.
We'll talk next week on Next Health Matters.
Will do.